Public health is a population-based field of science focused on preventing disease and promoting health. Every week, we will be engaging in interactive discussions and analyses of the latest public health issues affecting you and your communities all around the world. This is the Public Health Insight Podcast.
My name is LaShawn, and I'm here with Will, Ben, Sully, Linda, and Gordon.
Before we move on, it is important to note that the views expressed in this podcast are our own and do not represent any of the organizations we work for or are affiliated with.
The Global Status Report on Road Safety 2018 by the World Health Organization highlighted that there are about 1.35 million road traffic-related deaths in 2016, and this number continues to rise each year. That means every day around 3,700 people are dying on roads globally, along with tens of millions of people who are injured. Although world leaders have expressed commitment to the reduction of road traffic deaths by 2020 through the Sustainable Development Goals, little progress has been made. In this episode, we will examine the global burden of road traffic deaths and injuries. So, as you've just heard, I'm not too sure that many people are aware of how many road traffic-related deaths and injuries occur globally each year. So for me personally, I was actually shocked when reading this report. So to establish context and the bigger picture, let's begin by discussing the overall global burden of road traffic deaths and injuries to really drive home the point that this is indeed a public health issue worth highlighting. So what do you guys think about the report that you read, and maybe how you felt about some of these jarring stats?
Well, personally, I was shocked too, because I was unaware that the number was so high. And when I go in my car and, I drive to the grocery store or to go to work, I expect to make it home safely. It doesn't often occur to me that there's much of a risk involved. And maybe that's the issue, that my risk perception is so low, because what we're seeing is that road traffic deaths are a leading cause of death and injury too. So yeah, it's shocking.
Yeah, one thing I noticed and one thing I was curious about is what are these numbers before the implementation of seatbelts worldwide? Or even within this report, how many countries, be it low or middle income, still use seatbelts or have the proper enforcement of seatbelt policy, and whether that affects the numbers?
Yeah, that's definitely an important fact. I think when it comes to other countries, developed countries or developing countries, they have different regulation and enforcement methodologies that they have in place. So I think there's going to be differential outcomes based on that.
One thing I'll add too is when we think of preventable deaths or premature mortality in public health, we often think of it being as a result of, diseases. So whether it's substance use, diabetes, or even infectious diseases. And we often channel our resources in that way to prevent early deaths from those kinds of things. But in the context of road traffic deaths, it being ranked the 8th leading cause of death globally, I think that was a bit of a surprise for me, and it probably will be a bit of a surprise for our listeners as well.
Yeah, so I'm kind of wondering now, why is that a surprise? Why doesn't this issue get more shine?
I think part of it is it's almost become an acceptable risk to using the road, or whether you're driving a car or you're on the sidewalk. It's kind of become an acceptable risk in a sense where these things happen and there's nothing we can really do about it. So it's a natural human instinct to not kind of worry about things that we can't control. So that's probably a partial explanation for why it doesn't get as much attention.
I agree, Gordon. I think as a society, we tolerate a certain amount of deaths. And unfortunately, road safety is going to be a part of it because we're so accustomed to, using vehicles as transportation. And it's part of our culture. And looking at, Canada and my experience traveling to Sri Lanka, over there, you would have really busy streets, like similar to those videos you would see of India, where there's like 20 different things happening at once. And then the culture there is, you just got to jaywalk through it. And you're like, how do I even attempt to do this? And it's like, you'll figure it out. We'll adapt. So instead of enforcing road safety laws to make sure everything is safe, it's more along the lines, we just have to adapt to this and figure it out. And then there's this unspoken rule between the driver and the pedestrian of right of way. But nothing is like actually tangible.
Yeah, and because people normalized it and got to adapt to it and think that death would be just an inevitable thing. Responsible governments and institutions, as a consequence, would think that solving for these problems are first pointless and second expensive.
Right.
So like ideologically speaking, it's problematic.
Yeah, and then you have to look at the governments as well. Like, for example, if you want your local government in whatever country, and we're going to be talking more about middle income or low income, if you want them to come and fix the road or set up a safe road, how long is that going to take realistically? Versus me, who I have to cross this road every single day to either get to work, etc. I'm just going to go and figure it out. And then by the time the government comes in, it's not an issue anymore to me, even though it is in the grand scheme of things. But there's a disconnect between what is actionable and then what is realistic.
Yeah, and I think part of the reason also, to put a ribbon on it, it lies in which countries are affected the most, right? So middle income countries are disproportionately affected, as they have 90% of the world's road traffic deaths. So like with everything else, with Ebola and malaria and diseases that affect the most vulnerable populations in the world that we're living in, those tend to get less attention because all the resources are concentrated into the high income countries, which are doing the best on these indicators.
And also, I think in low and middle income countries, perhaps their priority is alleviating, diseases like diseases of poverty or, malnutrition or something like that. And so perhaps if they get funding from high income countries, it's not going to go towards road safety. It's going to go towards medication for, let's say, malaria or something. So it's hard to prioritize road safety when you have other disease burdens as well.
Yeah, and it's also harder to conceptualize from a healthcare perspective because, as Gordon mentioned earlier, we're so focused on diseases and healthcare specific problems, those first 7 that come before road safety. It almost seems like road safety is more of an infrastructure or urban development problem. So it's there's a disconnect between that conversation.
Except we're trying to push the message that road safety is achievable and that deaths due to road accidents are preventable, and it is part of public health.
Yeah, exactly. And I think we as public health professionals have to kind of reiterate on the point and watch our kind of terminologies that we use when we're talking about these traffic related deaths. A lot of the times people bring up the term accidents, but in fact, this kind of brings up the idea that, it wasn't anyone's fault and these things weren't preventable. So we have to kind of move ahead with our terminology and maybe fine tune it more so that people understand that it's not something out of your control. There can be steps in place to mitigate these things and minimize damages.
Yeah, that's a great point, LaShawn, for sure. In injury prevention, it's a challenge to kind of frame, certain issues that can result in trauma or even death in a way that convinces someone that the event that led up to that was a preventable event. And by calling it an accident, like you said, takes away the kind of urgency to put effort into looking at it from a holistic perspective and prevent it from happening in the future. So putting it into perspective, that should be one of the key focuses of the folks in health promotion.
Yeah, that's a great point because as we'll see later, we're going to be talking about Vision Zero, which actually brings this to the forefront in terms of the terminology used. They want to make sure we move away from the term accident and kind of ensure that everyone understands these things are preventable.
Let's go back to, there was a point in the report where, it was mentioned that there were 1.35 million road traffic deaths in 2016, which is an increase from 2 decades ago, from the early 2000s. However, they were saying that the overall rate per 100,000 population remained relatively constant. So I was wondering, why is it important to even make that distinction? Should we not only just care that the number went up from 2000 to 2016 and not really care about how much the rate increased, or what is the rate anyway?
I think it's important to look at the rate though, because it shows that something is working. Because if the rate was increasing, then we know, okay, the problem is definitely getting worse. But the rate is relatively constant. So it's not getting worse. It's not getting better, but it's not getting worse. So perhaps that shows that the prevention efforts are working to kind of maintain the rate of death.
Yeah, and it seems that from reading the report, one of their biggest calls to action was the fact that, sure, although these rates have probably stabilized over the last few years, one of the biggest things that we're missing out on is the potential to achieve that SDG goal and target that they wanted to have. So that's why it's still important, because even though rates are still remaining constant, there's still people dying every day on the roads, and those are things that could be preventable.
Yeah, so for people who are kind of new to, public health or public health related careers or education, rate per 100,000 population is often used when you need to standardize a certain indicator, because two different countries can have, like if you compare Canada and the United States, the United States has about 10 times the number of people living in the country. So if you look at, for something like, for example, coronavirus cases, and you only look at the numbers, well, the United States have more people, so they're more likely to have more numbers. But if you look at it as per 100,000 people, that helps you to see and make comparisons across different countries. And this is why in the case of road safety and road traffic related deaths and injuries, when we're comparing countries across all continents and of different sizes, it's important to put these numbers in context based on the sizes of those populations.
Gordon, I think that's a really good point. And if I can add, I think having the rate per 100,000 also allows public health professionals to compare road-related deaths with other cause of deaths. For example, homicide, death from alcohol or drug-related incidents, suicide rates, this kind of thing, so that you don't just look at road injuries and deaths within a vacuum, but you see how, how it compares and with other cause of death.
Right. And that's important too, Will, because like Sully said, when you're making the case to decision makers and policymakers, framing it per 100,000 population can help them make a comparison to see where to allocate resources as well. So that's a good point.
Yeah, even adding on to that, there have been a couple of economic analyses on road traffic injuries and deaths in low and middle income countries and even developed countries. So some of these estimates are pretty old and from the late 1990s, but this one report showed that road traffic injuries cost around $518 billion US worldwide. Wow. And $65 billion US in low and middle income countries. So that the stat also pushes further and says that these exceed the totals that these countries actually receive in developmental assistance, right? And to give even further stats, more recent stats actually. So in terms of crashes that occurred in 2017, the cost of medical care and productivity losses that are associated with such injuries and deaths from motor vehicle traffic crashes exceeded 75 billion in the US.
Right. And I think that's a good point too, because this episode is based on road traffic deaths and injuries. So we also have to account for things like, the people that did survive, how much has their quality of life changed? The loss of productivity in terms of providing for their family, children being disabled and missing out on fulfilling their potential in the future. So, and I know compared to the number of people that die from road traffic collisions and incidents in 2016 was 1.35 million. I believe the number of injuries that occurred from road traffic was about 50 million. So there's even more people affected by the injuries directly. So that's a good point.
Yeah, it's such a complex situation that it's hard to capture it without going really into it. Because I'm also wondering, based off the economic analysis and the affected qualities and whatnot. So qualities would be quality adjusted life years. So for example, if you were involved in a road traffic accident, you survived, but you had a debilitating injury, that would affect the quality of your life years that you have remaining, because you would have, for example, decreased function, unable to work, etc. So back to my question is that it's really hard to not be preventative, because if you're able to prevent the action from even happening, the collision per se, then you get a lot of bang for your buck. But if you try and focus on interventions after the collision, for example, healthcare, physiotherapy, etc., it's very costly.
Prevention versus treatment.
Yeah, well, in terms of levels of prevention, that would be more like primary prevention would be, before it even happens, and secondary, would be more like harm reduction from driving. And then tertiary would be, it already happened, and how can we best help the people that are affected? So,
as mentioned in the report, road traffic is the 8th leading cause of death for all age groups. So what categories are ahead of it? Some probably well-known diseases.
Yeah, I would say for sure you'd probably have the cardiovascular diseases up there, and you'd probably have things like diabetes, and I would say some cancers.
Yeah, like lung cancers.
Alzheimer's and dementia as well.
But, there's only 7 more ahead of it. So it's not a long conversation, as we're finding out that road traffic is indeed in the top 10 for leading causes of death. So still a shocker.
Yeah, exactly. And specifically, it's the leading cause of death for children and young adults aged 5 to 29 years of age. And in the report, Dr. Tedros, who's the Director General of the WHO, he states the following: "No child should die or be seriously injured while they walk, cycle, or play. We must return our streets to our children. They have the right to feel safe."
Wow. This kind of even brings up the social equity piece, right? You imagine that children in kind of more lower income neighborhoods in developed countries and in developing countries in general would be disproportionately affected because the areas that they have to walk to school or play are less safe than some of the richer kind of neighborhoods, right? Because the neighborhoods would probably be designed more safely and such and such. So we haven't touched on it too much in this episode, but we're sure that when, this episode, we're talking about looking at it from a global perspective, but if we take a microscope and look at it from, more neighborhood to neighborhood, or, regions and countries to other regions and countries, we'll probably see some even more shocking numbers about which populations are more affected.
I guess that brings me to the question, why children? Why are these children being affected more by these road traffic related incidents?
Well, my guess would have to be probably related towards education. For example, in middle to low income countries, maybe the closest school nearby is only accessible by a bus that takes only X amount of people. Again, I'm going back to my India, Sri Lanka example because I've been there, is that you'll see buses just filled to the brim with people. And it's not even like everyone's seated inside. It's people are holding on to the sides. They're up on top. They're hanging on. And it's because that's the only transportation to get them to school or to work. That's the only opportunity there. So you're putting people in a more riskier situation because of what Gordon mentioned, is that there's social inequities in place.
I don't know if you guys had a chance to watch that video that I posted, but in the video by the WHO, it showed a reporter. I think she was in Thailand, and she was kind of showing a school and how at the start of the day, children are walking and crossing streets that are crowded with motorcycles and other vehicles, and there's no safe crossing. And this happens at the beginning of school and when they leave school, and the chances of a collision are greatly increased because there's no kind of safety precautions or mechanisms in place. And you could see these kids just, waving their hand in the air to kind of cross with the motorcycle coming full speed at them. So it was definitely very illuminating.
But I think the issue with that, though, I mean, I kind of have a question going off your point then, Mashan. It's that, I mean, it's an interesting, I guess, observation, but I still don't see how it kind of explains why, children are more affected, because it's like, like what's at its core, what's the reason, what's causing children and young adults between the age of 15 and 29? Like, why are they disproportionately affected by road injuries and deaths more than, let's say, an adult? Because I feel like if let's say if you're in a developing country, and if everyone in that society is all, I guess, facing the same issues of inequality, access to transportation, the lack of properly, safely planned communities, things like that. If everyone in the community is subject to the same kind of environment, then what's Like, why is there that distinction between the ages?
Yeah, just if you look at it from just a developmental or biological perspective, when a child sustains trauma, they're more likely to be injured because their musculoskeletal system hasn't fully developed. And then, we saw from the report also, or maybe another report, that head injuries from road traffic collisions or incidents are the leading, reason for why someone dies. So if you think of the undeveloped brain, if children fall versus an adult, the child is more likely to be more seriously injured and die, or get injured. So that's one of the explanations to why a child disproportionately dies from a road traffic incident. What would help answer your question even more, Will, is we don't know of the kind of road traffic collisions that don't result in any serious injury or death. We don't know if children are having more encounters with people on vehicles. And I think that would be something we'd have to look into.
Right. And we just got to remember as well, the reason I also did bring up that example is to also highlight the fact that oftentimes children aren't the ones behind these vehicles a lot of the times, right? They're not old enough to drive. And so the people that are in the cars who are more likely to be older adults or not children are going to be probably the safe ones in a collision that occurs on a pedestrian.
I think it's also important to highlight that within that 5 to 29 age gap, around like 15, 16 is when, teenagers do learn how to drive. And so a new driver, you're less skilled. And so maybe unable to, like, your reflexes may not be as sharp as someone who maybe has been driving for longer. And so I know we've mostly been talking about being on the pedestrian side of this 5 to 29-year-old risk group. But I think it's important to consider teenagers and new drivers within that group being behind the wheel and may also engage in more risky behavior as well. So that also could be part of it.
Yeah.
But there's also like a second part to that as well, because I know we're talking about the 5 to 29 years old range, but to play devil's advocate to that point, Linda, is that older drivers are more careless or more riskier because they have this perceived sense of skill, right? Like we see that individuals who've been driving for 30 to 40 years, you could say that they're more experienced, they're more likely to not make mistakes, but there also is a chance that they're more careless.
Agreed. But I think that their carelessness will impact a younger driver who may not be expecting that. Like the younger driver may be following the rules, but someone who may be more careless, then the younger person gets impacted.
Yeah, I think a big thing with this here is we've seen that developing countries have a disproportionate burden. And we're kind of using partly our experience with the, being in Canada or North America, which is more developed, where we have more rules and regulations about you can drive when you're, X age and your blood alcohol must be 0 and stuff. Some countries don't have those rules and regulations. So the behaviors of that age group in Canada might not necessarily be applicable to that same age group living in different countries, developing countries. But I also wanted to say, even if you look at it from just a logical perspective, if you compare it to the older age group where they have more comorbidities, children 5 to 29 are less likely to die from something like Alzheimer's, diabetes than older adults. So if you look at it from that perspective, it's usually something more unexpected that would be more likely to take their life. And that's why compared to other diseases, road traffic injuries or deaths are going to be higher as a portion of the pie for children versus people who are older.
Globally, we see that cyclists on the road represent around 26% of all deaths. Those who use two-wheelers or three-wheelers around the world represent about 28% of deaths. Cars make up 29% of deaths, and the other 17% are unidentified road users. But what we find is that these deaths occur disproportionately amongst those vulnerable road users, as I just mentioned. And it seems that in many low and middle income countries have the most or a higher proportion of these vulnerable road users.
Yep, that's exactly right. If you imagine a developing country that doesn't really have proper road infrastructure, it's probably going to be easier to navigate with a 2 or 3 wheeler, right, in the smaller streets. And then we already, we beat the point home about developing countries being more disproportionately affected by road traffic deaths and injuries. And it then makes sense, given the proportion of the types of vehicles available in those or being used in those countries, that this is what would come from the data.
Exactly. And we also have to remember that the prominence of the vulnerable road users may not be able to afford the safest vehicles, which are, I guess, the 4-wheel or the Jeeps, the trucks.
Or even older cars, right? There's probably, not the newer cars with the safety features, etc.
And even building the roads, I mean, we have roads where after a few kilometers, the surface of the road will be irregular. So once you drive over it, it makes like a certain distinct sound that kind of like wakes you up if you're on long road trips.
Right.
And if that's not available because the infrastructure is there, the government's not supporting that in these countries, then that's obviously a factor that's not going to help in terms of preventing road collisions.
And in some places too, like I know in Ghana, for example, sometimes when you're driving, it's like a free for all. So if you're more aggressive, then you're going to get to go. But if you're one of these more vulnerable road users, and let's say you don't have a bike lane or, a designated space for you, already you're more at risk.
Yeah. And it's unfortunate because aggressiveness is the culture. Aggressiveness means my right of way and I'll be able to keep myself safe. But if you end up finding someone else who's also aggressive, then, that culture breeds a collision.
I want to recall my personal experience regarding traffic and the dangers that come with it.
Talking about your driving skills?
No, not with my driving.
Hey, Sully's a great driver. Sully's a great driver.
No. Yeah, I'm great. Don't worry about me. But my time back in Syria, I remember my mom not allowing me to cross the road till like a certain age. I think I was like grade 5 when I was allowed. So with my upbringing, I was fortunate enough that I was protected. But a lot of people just follow like risky behavior, thinking that it's normal and. It just leads to preventable deaths.
Yeah, and even that's a good point, Sal, because if you even think of your experience compared to other people's experience, I'm sure there's in some developing countries, children have to start going to work when they're very, very young, right? So if you think of the risks that we would have where we're either at school or home, when we're, a lot of people who grew up in, Canada or North America or whatever, or any other developed countries, compared to a poorer developing country where the child is expected to go out before they're 10 to get work, they're going to have more exposure to being impacted by road incidents, right? So if you look at that alone, that could also explain Will's question earlier about the increased vulnerability specifically for children. Even
not just going out to work, but even just crossing the street, just your regular going out to just do errands or just be a kid outside. Here or in Canada anyway, we're taught, push the button at the crosswalk and look both ways and wait for cars to stop and then cross. It's like ingrained into your brain. But again, my experience going to Ghana, I would be waiting to cross the street and my family would be like, let's go. What are you doing? You just cross. And I'm like, wait, I'm not used to this. It's very much a cultural shift. And so I think I mean, we haven't got to this point yet, but when we get to the point of talking about what to do about this, it's more than just, putting signs and enforcing it, but it's also like changing the cultural behavior or cultural practices surrounding road safety. And I think that might be the bigger challenge. And
the people living in developed countries, some of them have backyards, and then some people living in other countries don't have backyards for children to play in. So, end up playing near a street. Car comes near the sidewalk or whatever other area, and a lot of people die that way.
Yeah, it's a great point that you guys mentioned, and thank you for sharing those personal experiences. And I think these are some of the points that we highlighted are some of the reasons why the UN found this to be an important issue and why they decided to include it and adopt road safety into the SDGs, which are the Sustainable Development Goals. So specifically in SDG number 3 and SDG number 11, SDG 3 looks to halve the number of global deaths and injuries from road traffic crashes. And SDG 11 looks to provide safe, affordable, accessible, and sustainable transport systems for everyone, improve road safety, and expanding public transport. And so there's also special attention to the needs of vulnerable individuals, women, children, persons with disabilities, and older individuals. So this step, this movement, the acknowledgement to have road safety embedded in the SDGs was an important milestone in terms of global road safety, because it really defined it and kind of confirmed it as an essential health need and, you know, a global issue. Yeah.
Yeah. Not to belabor the point, but if you think of something like road safety, which we're going to get into in the next episode, requires a ton of investment to infrastructure. Of course you can have the seatbelt wearing and not, no drinking and driving and those kinds of policies. But if you even get there, but a huge part of it is just having roads that are just safe to drive on safely. Right. So I think there's just these goals that very optimistic, but the road infrastructure part of it that requires a significant investment has me a bit worried.
Right. And I think that's why we keep making this distinction between low-income countries and high-income countries, or developed and developed, because the evidence shows that there is that association between road traffic deaths and the income level of a country, because it requires such an investment. And if we don't address that investment piece and the capacity of a country to meet that need, like financially, then we're missing a huge factor.
Our discussion highlighted that road traffic deaths and injuries are a huge economic and social burden globally and are often not talked about as much as many of the other leading causes of death, such as diabetes, strokes, and ischemic heart diseases. In the next episode, we'll be talking about the importance of leadership, policy, and best practices as a means of tackling road traffic deaths and injuries.
Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our content and would like to stay up to date, follow us on Instagram, Facebook, Twitter, and LinkedIn. To learn more about our community initiatives and how you can support us, visit our website at thepublichealthinsight.com. Join the PHI community, and let's make public health viral.